Lecau and Charitable Aid Uganda brings to you a short documentary about the 5-day health camp that was organized by Lecau. Lecau and Charitable Aid Uganda is a community-led non-government organization located in Kinyamaseke Town Council, Kasese District in western Uganda, a few kilometers from Uganda-DR Congo border. Since its inception in 2002, Lecau has improved the community through its impactful programs ranging from education by offering scholarships to the needy students, health promotion through health camps, construction of clean water wells and menstrual hygiene activities, community livelihood program through construction of houses for the needy, distribution of food trees from the nursery, advocacy for civic rights and representation of litigants in courts. Other social activities include sports gala and Christmas package and Christmas children's dinner. As part of its commitment, Lecau and Charitable Aid Uganda through the Health Promotion Program conducted a free medical camp from 23rd to 27th September 2024 to complement Ugandan health sector and increase availability and accessibility of health services to the most underserved community of Kinyamaseke and surrounding areas.
On this 23rd day of September 2024, we are grateful to have this second medical and healthy camp at Kinyamaseke Health Center 3.
Yes, I'm Masaraka Mutamira. I'm a senior clinical officer and in charge of Kinyamaseke Health Center 3. We have received a team from Lecau and Charitable Aid Uganda that is offering a camp with us at Kinyamaseke Health Center 3. And this camp is going to take 5 days, starting from today, Monday, up to Friday. In this camp, we are offering services to the community for free.
This health camp, the second annual health camp, medical camp, we have specialized clinics. We have the eye clinic, then we have the dental clinic, then we have also other clinics like the cervical cancer screening. We have now the general clinic, which includes the diabetes testing, that is sugar levels, that is hypertension, and other more health disorders. We are very grateful to our sponsors. For the next 4 days, starting today, 5 days, we are going to have 33 professionals who are helping our community to find out and treat them and refer them and advise them so that our community can be independent from diseases. Thank you so much.
Key health services during the camp were daily health education, eye checkups, dental services, cervical cancer screening services, antenatal and family planning, general medical consultation, HIV testing services, laboratory services, dispensing of essential medicines and referral services.
Generally, the community here lives on less than $1, which makes accessibility to general and specialized screening and diagnostic services difficult. So Lecau tries to bridge the gap by bringing medical services near so that the community member can be able to access a medical doctor and other medical members of the team to have the screening, diagnosis, treatment, and referral to other higher services as quick as possible.
The results of the camp continue to show high burden of disease in the community. Non-communicable diseases like hypertension and diabetes continue to appear more prevalent in the community. Increased cases of cataracts and glaucoma in adults were highlighted during the camp. Teeth replacement, dental extractions, minor surgeries, eyeglasses were given to people with sight errors, and dispensing of prescribed essential medicines.
The results of the camp are a representation of what is happening down in the village, a typical high burden of disease in our community. From our screening, we are seeing that hypertension is at 15%, diabetes at 5%, that is among people who are 40 years and above. But also from the eye, we are seeing a high prevalence of cataracts among the elderly. We are seeing some cases of glaucoma also coming from the eye clinic. We have also seen from the lab high cases of urinary tract infection, hepatitis, and also as well as high cases of H. pylori that is causing some gastric ulcers. So as health workers, we will work with Lecau to ensure that we have problem-based projects that will support this community to improve health. Therefore, Lecau and its partners must work together to find long-term solutions towards improving the medical services for this community, and also work on projects that are specific to highly prevalent illnesses, as we have seen in this camp.
Lecau and Charitable Aid also used the opportunity of camp gatherings to educate the masses on civic rights and distributed free siblings to the community members.
Today we come to the end of the 5 days medical camp. We also do annual activity of fruit trees distribution. And today we are going to distribute over 3,000 fruit trees.
Lecau will continue to work with the community, their partners and government of Uganda to transform the community and play a catalytic role to government of Uganda health programs.
As we close this camp on today, 27th September, we acknowledge our partnership with our community, external funders, the government as part of our programming. We will leverage on this available opportunity to build a management system that prioritizes the health needs of our community, design target-based project that increases availability, accessibility, and usability. On behalf of Lecau and Charitable Aid Uganda, and on behalf of this community, I want to thank all of you, the donors and funders, who have made all the efforts to contribute towards this activity. We actually recommend and request that you do the same next year. At the same time, we will be serving the same community. As you have already seen the results in the reports, this activity actually, when done, will have good yields. I'm Henry Morris, the Executive Director of Lecau and Charitable Aid Uganda.
Lecau, charity in diversity.